NHS England has now published league tables. It's the very first time, ranking the highest to lowest performing trusts and hospitals. The Health Secretary says this will help the public make informed decisions. But the trusts themselves have questioned whether the right metrics were used to decide the rankings. Wes Streeting has vowed that he'll dock the pay of those running the worst performing trusts to try to incentivise them to improve the services they provide. The tables will be updated, they say, every 3 months, so patients can see where to access the best care. Now, most of the top 10 is taken up by specialist hospitals like Moorfields Eye Hospital, which comes in at number 1. But beyond that, the number 1 ranked hospital in the country is Northumbria Healthcare. The worst ranked hospital is the Queen Elizabeth Hospital in Kings Lynn, with the Countess of Chester Hospital, where nurse Lucy Letby worked, not far behind it, at second to last. I wonder if you live near any of those hospitals and you already knew that. Maybe everybody has a good idea whether their nearest hospitals are good or not good. But my mother's saying about one of our local hospitals, whatever happens to me, for God's sake, don't send me there. Do remember it. That was years and years ago. So do you think these rankings will be helpful? 0207 862 2222. So, I mean, I have to call you Sharron.
Please call me Sharron.
Because you can't announce what you're about to be called, although it has been all over the papers.
But you will always call me Sharron, please.
But do you feel different now you're ennobled or just about to be?
No,
do you feel the same?
Absolutely not. No.
Because I just can't help seeing you in ermine suddenly and just in a marvellous cloak and, you know, at the opening of Parliament and all that. It's very, very exciting and really, really, really well done. What do you think about this hospital thing?
I think what I like about this is that if you were in private industry, you would be very much judged on your performance and you would be losing your jobs if you weren't very good at it. And unfortunately, I think inside of certain civil service jobs, that hasn't always been the case. And we are talking about people's health here. You know, I think it's going to be a little bit more difficult for people to be able to pick where they want to go. Let's be honest. You know, I live in Bath. I'm not going to be able to go to Northumbria to go and get some treatment just because they happen to be the best hospital. So, you know, if it improves services, then it's got to be the right thing. And personally, I think we do need to hold people to account that are involved in public service.
Sam, I wonder, though, you know, if you're admitted to hospital, usually it's to the closest one or it's the one where the specialist whose skills you need is based or whatever it is. Imagine packing your case this morning, finally your operation has come up, you know, you're not on the waiting list anymore, you're feeling a bit nervous like you do when you go into hospital, and you suddenly find the hospital you're going to has fared very, very badly and is right down at the bottom of the list. What can you actually do about it anyway, except feel awful?
Exactly. I mean, you feel awful anyway because you're going to hospital.
Yeah.
But I mean, this kind of reeks of Ofsted, really. It's like like these trusts have said, what are the metrics? How do we know how they are rating these hospitals? I mean, I don't think there's a person in the country at the moment that would be like, oh, well, my local hospital is fabulous. Like, you're never waiting at A&E, etc., etc. So it's just kind of, I do agree with maybe punishing some of the directors, but it all depends on like where the hospital is in the country. It depends on the catchment area. How many people is it servicing? Is it a tiny trust that's only servicing a few people, like you said, like a specialist one? I mean, there are so many variables that I don't think that looking at something, you know, that, like you say, like making people feel bad about the hospital they're about to go to when they have no choice, either financially or because, of course, they can't go private or they're literally on their doorstep. I struggle to see how it's helpful.
Donna, what about the feeling that in some hospitals there are some wonderful wards, you know, where they absolutely excel? For example, their geriatric wards are just a pleasure. You know, you're so relieved and delighted to have a member of your family there. If you're admitted there, you feel so comforted. But there may be another ward that isn't delivering the same thing. Or, for example, as Sam says, A&E may be, as they always are, so clogged up with a terrible waiting list and everything else. You know, so is it fair to put these huge kind of differences of department all under one category and say good or bad?
I don't think it's fair, personally. And also, is it because of lack of funding? Yes, it is. I don't think it's the performance of the staff, because they're all kind of educated to a certain level, I guess. It's lack of funding. I mean, personally, there is a hospital near me which I won't actually go to. I'd actually take a sort of 30-minute journey to go to another one because I've had a bad experience there. But there just needs to be more funding.
OK, more questions. So in your area, I'm not asking you to name the hospital, of course, or the area. That wouldn't be fair to anyone. But what I am asking in all seriousness is, do other people who live near you feel the same about that hospital, or is it just you and your one experience?
I believe that other people feel the same. But also there has been a mixed view. I've spoken to many people who have had a really good experience there. For me, I had a surgery which should have taken sort of like a day. But I ended up being in there for 2 weeks, and it wasn't actually the surgery, it was waiting for the bed. And it was really bizarre, because I only lived down the road. I said, I can go home. They said, no, you have to stay in the bed, because if you leave the bed, then you'll lose your place. And it was
And
so
they
I
can't
missed
do the
out.
surgery.
Then they can't do the surgery. So I missed out on a lot of
But is that the
work.
hospital's fault, or is that lack of social care? So there was nowhere for the people who were in the bed to go, so they were blocking the bed, or what? What was going on there?
I think there was probably miscommunication because of lack of staff and lack of funding.
I mean, demographics is obviously very important, isn't it? I'm originally from the West Country, and if you look at, say, the demographic of Cornwall, you've got a lot of sort of slightly older people down there that are going to require more service. Then they have an awful lot of tourists that come in the summer, which aren't local council payers. So I think that's really important. But I do think it's important that we can hold administrators to task. Do you know that there are now more administrators in the NHS than there are frontline medical staff? And so I think it's very important that we understand where the money's going to and how efficiently we are spending it.
But I also think that there are certain wards that are run with compassion and efficiency and people in the wards feel seen and heard, but not just seen and heard. They will, for example, not have their lunch stuck there when they can't reach it because they're wounded or injured and nobody feed them, and the family come later and think, have you eaten anything all day? And they haven't. That sort of awful
Does that
thing.
mean we need more nurses, though, and less administration?
Yeah. Well, then the other argument is that, the NHS is a multi-billion-pound business. You're not talking about tuppence for a box of aspirin.
And tens of thousands of members of staff, of course, that are all doing different things. So I doubt there's anybody that's even an administrator who's sat there going, "Ooh, I've got nothing to do all day." And they're all flat out all the time. But I mean,
but then should we not rank them on how good they are? So if we have better ones, can we not learn from the better ones how to make the ones that aren't performing so well better?
But again, maybe like as you say, we don't know the metrics. So give the people at the bottom more funding to sort their hospital out, and maybe the funding and sort out the funding at the top that maybe they don't need as much.
Just as many competitions that we're aware of, it's a public vote.
Yeah.
You wonder if there were a public vote from people who were treated in that hospital, what they would say, and it might not at all be the same thing. But let's talk to Tom in Norfolk about this. Hi, Tom. Tell me about how you feel about this ranking system.
Well, I mean, I can't find no fault with King's Lynn Hospital whatsoever.
Oh, right, and that's the one that received a terrible rating.
Well, I just can't understand it. My son from Harrogate has just phoned up and told me that it's got such a bad name. Well, the nurses and doctors, everything is absolutely spot on. My wife has been in with hip operations. I've had about 30 or 40 visits to hospital, stayed in. Lovely, lovely, lovely people. I trust them implicitly. I trust my life with them. It's so emotional to say that they're behind in whatever they are. The thing of it is, this hospital, in my eyes, is one of the top hospitals. The nurses go beyond what they're paid to do. Absolutely brilliant people.
So, Tom, obviously your experience of that hospital, which has been ranked the worst one, is fabulous. You couldn't praise them more highly. They couldn't have cared for you better or more kindly or more brilliantly, because here you are talking to me. You must be in reasonable health as a result of the whole treatment you've had there. So does it make you feel as if the list just really isn't worth the paper it's written on then?
Well, yeah, it's not. The list, I don't know who invented the list. They obviously haven't been down to Norfolk, to King's Lynn at least. The hospital there are things want replacing, and the organisation perhaps want reviving a little, but the actual nurses, doctors, they can't give you enough. They just cannot give you enough attention.
Well, I'm really pleased you phoned, and even more, I'm so pleased you've been so beautifully cared for at King's Lynn Hospital. I think it's very important that you have rung and said that, Tom. Thank you so much. And you can see it's a very subjective thing. If you have a baby there, you come home with a beautiful, healthy baby, you couldn't thank that hospital enough for the rest of your life. I mean,
Absolutely. It's Emergency Services Day today, and a few years ago I got knocked off my bike and broke my leg, and I can't tell you how grateful I was when the ambulance turned up. So all of us have those experiences, we're so grateful grateful for people that do those jobs.
And lots of us have a very close emotional tie to our local hospital. You know, we thank them. They absolutely feature in all our lives in such a huge way, and deaths too, of course. And we really feel very bound to them. So I think you feel very offended on their behalf, very hurt, but not half as hurt as the nurses and doctors and porters and everybody else who work in them. Now, Susie's on the line in Plymouth, and Susie, I'm so pleased you rang because you're a healthcare worker. What do you think of these lists?
Yeah, it was really nice to just hear Tom then saying how much he appreciated, because I'm concerned. I'm a nurse there, that if people are coming in even more disgruntled than they already are, we're all doing our best, and I think it's kind of funny that they're saying, it would be a good incentive, as if we need one. Like we want the best. That's why we've gone into healthcare, because we want to look after people. We want to do the best for them. We aren't, if we're not as a hospital performing as much as we can do, that's not because we're not trying hard enough. That's because we don't have the facilities to, particularly in Plymouth. We've got way more people than we can possibly handle in that hospital. We're lucky enough that we're getting a new emergency department, and that's really, really good. But it's not for the want of not trying or not wanting to. So I don't think that naming and shaming hospitals is going to be particularly helpful, because we are all doing what we can. And if people are just coming in grumpy about the fact that it's not the highest listed hospital, then I don't know what that serves as a purpose or how that helps.
Absolutely, I feel for you in this, Susie. And let me ask you something else. Sharron was talking about the very dense management layer, and we all know that there are many, many managers in the NHS. From your perspective as a healthcare worker, a nurse, do you see too many managers, or do you think actually it's such a cumbersome and it's such a huge business, the NHS, that they need these people to run it? You haven't got time to do it.
I think I think there's definitely a place for a lot of the managers in a lot of the areas. There are a lot of managers working on trying to find the best areas. There's a lot of waste of things like single-use plastics and things like that. And if we've got, manager areas where they are finding those and trying to cut them out, cut them down, I think there's definitely a place for things like that. There are also, I think there's always improvements, aren't there, with whether we can have more people on the floor. And I think as long as managers are prepared to come out when we need them to, when it's necessary, and they're happy to come on the floor and help out, then I think it's great, because I think we do need them. They
Susie,
just need.
What's the situation with staffing levels in terms of, are there enough nurses? Can you recruit them? Can you retain them? Or are you rushing around doing the work of more than one person?
It's really improved down here, I have to say, which is really good. It's really nice, because a few years ago we wouldn't have been saying that. We've had a nice load of additional nurses coming in. We've had an international contract, which has been fantastic for our hospital. So we're really lucky on that front. But we've still got more houses being built, which means we've got more people coming in, and the hospital itself isn't big enough. And I think one of the main problems is because technology has evolved, there's more treatments and things, which is fantastic. Yeah. But then we can't keep up as a hospital with all these new wonderful things that have occurred. So that's a difficulty as well.
I'm so glad you phoned, and thank you for all you do, and pass on obviously our grateful thanks and compliments to everyone in your ward and your department. I mean, the idea, Donna, of having to incentivise hardworking nurses, doctors, by saying your hospital's no good, and that's supposed to kind of rev them up and get them taking their job seriously. And Susie says we're already doing absolutely everything we can.
It's absolutely crazy. Just, they need more money because they're saving lives at the end of the day. You know what I mean? Like, I feel guilty because I get paid very well for my job, but all I'm doing is reciting lines and just telling my story through a narrative, whatever. But I'm not saving a life, and I'm getting paid more than my friend who's an anaesthetist. And should I say that? Anyway, yes, I've done that. Whatever.
You can say that.
I feel awful, but they need more money. That's it.